The New York Police Department has issued a stark warning to U.S. healthcare executives about heightened threats to their safety after uncovering an online hit list in the aftermath of last week's assassination of United Healthcare CEO Brian Thompson. In response to Thompson's murder, corporations have rushed to bolster security for senior leaders among fears of copycat attacks. The killing has been celebrated in certain corners of social media, further amplifying concerns. The NYPD's alert, detailed in a bulletin, highlighted viral posts sharing the names and salaries of health insurance executives. It also noted the appearance of wanted posters targeting corporate leaders, which have been spotted across Manhattan. Luigi Mangione, the suspect in Thompson's murder, appeared in a Pennsylvania court on Tuesday to face second-degree murder charges. Law enforcement officials said that fingerprints from the scene matched his. A notebook found in his possession reportedly contained entries describing plans to target healthcare executives at a bean counter conference. One excerpt read, "What do? You whack the CEO at an annual parasitic bean counter convention. It's targeted, precise, and doesn't risk innocence." Thompson was shot upon arriving at the hotel for a United Healthcare investor meeting. The NYPD Bulletin urged companies to enhance security measures, warning that Mangione's actions could inspire other extremists or grievance-driven actors. The document cited online reactions to the killing, including positive endorsements and calls for further attacks, as well as conspiracy theories surrounding the incident. Some posts rationalized the killing as retribution against the healthcare industry. One user wrote, "My mum was denied chemo multiple times. They missed her cancer for 2 years. She will have life-altering damage because of it." Another comment on Reddit said, "The politicians are compromised and the corporations are suffocating us. All CEOs should be considered." The fallout has extended beyond the healthcare sector. Corporate executives in other industries have expressed growing concerns. The NYPD continues to urge vigilance, emphasizing the broader risk posed by acts of violence stemming from grievances against corporate leaders. 2 years before Brian Thompson was fatally shot in New York, a LinkedIn post he shared as a health insurance executive drew a wave of angry and anguished responses. "Making healthcare more affordable means more money in people's pockets," wrote Thompson, CEO of United Health Group's insurance division. "That's more important than ever right now. Reducing drug prices and improving price transparency are 2 ways we are working to lower costs for United Healthcare members." The post received sparse praise. Instead, it was met with pointed criticism. "I'm curious, money in whose pockets?" asked one user. "It seems members are not the primary recipients when the ratio of CEO to median employee pay is 30-1, and revenue increases over 10% in a year." Another commenter recounted how her 86-year-old mother's healthcare plan was terminated without notice. One particularly scathing reply came from a woman battling stage 4 cancer. "Do better," she wrote, explaining how her insurance coverage had been cancelled after United Healthcare repeatedly denied her medications. "Every month there's a different reason for the denial. We've spent well over $20,000 this year and have maxed out our savings. Since we are in our 60s, we don't have time to recover." Thompson's assassination by a masked gunman has reignited public fury over the state of healthcare in the U.S. Sympathy for the executive has been scarce as nurses and patients flood social media with horror stories about dealing with insurers. Thompson was likely targeted because of his role in the health insurance industry. Thompson's estranged wife, speaking to reporters, revealed that he'd previously faced threats possibly related to healthcare coverage. The U.S. healthcare system has long faced public scrutiny. In April, Senator Bernie Sanders described it as a system designed to make huge profits for insurance companies and drug companies rather than to provide affordable healthcare. He called the system totally broken. While insurers argue that rising medical costs, not profit motives, are to blame, discontent continues to grow. Approximately 85 million Americans are either uninsured or underinsured. Health insurance costs now account for a significant portion of household income, with family plans offered through employers averaging $25,572 annually, up 7% from the previous year. For many, insurance coverage feels like a financial burden rather than a safety net. Research by the Commonwealth Fund found that more than 40% of working-age adults were billed or charged co-payments for services they believed their insurance would cover. Denied claims have also fueled resentment. A Senate committee recently accused the country's three largest insurers, United Healthcare, Humana and CVS, of disproportionately denying care, particularly for nursing services related to falls and strokes. The companies dispute the findings. Public trust in the healthcare industry remains low. A Gallup poll found that less than a third of Americans hold a positive view of the sector, ranking it alongside oil and gas, the federal government, and drug companies as one of the least trusted industries. United Healthcare made over $6 billion in profit this year. That's their net income from an annual revenue of over $100 billion, representing an increase over last year. These figures are astonishing, considering that access to quality health services in America is appalling. I would go as far as to say that U.S. health care is an oxymoron. It does not exist. There are health services which, if you can afford monthly premiums into the thousands or have corporate coverage, then you might survive. This is an all-too-familiar story in America and aligns us with some third-world countries in terms of access to health. Despite this, healthcare is one of the most profitable sectors in corporate America, worth almost $5 trillion every year. The scam, as we know, are the inflated rate card prices that healthcare providers charge and the vast sums paid out by the insurance companies. As frustration mounts, Thompson's death has become a flashpoint, highlighting not only the risks faced by corporate executives, but also the deep dissatisfaction of many Americans with the U.S. healthcare system. I'm Anthony Davis. You can find me on the 5 Minute News YouTube channel and podcast, on Wednesdays co-hosting Uncovered, and on Sunday on The Weekend Show with Midas Touch.